Good morning, everyone. I think we're ready to go ahead and get started. We want to try to keep this day on track as much as possible. So, I'm Joyce Saylor. I work within the Division of Cancer Prevention and Control at the North Dakota Department of Health.
And I'm Shannon Bacon. I work with the American Cancer Society in North Dakota.
So Shannon and I have served as co-leads in putting or helping to spearhead putting today's training together. But we have some other individuals that we would like to thank as well.
And we also want to say a shout out to South Dakota. So we have a great room gathered today in Jamestown. We also have a great group gathered in Chamberlain. So they're watching us via live stream, and we'll have a couple of their panelists coming into us through live stream later. We really want to thank our planning committee members. There was a great group that worked on this training. If I say your name, please stand. Tinka Duran with Great Plains Tribal Chairman's Health Board, Mary Hoffman with CHAD, who's running our live stream right now, Colette Hessler with CHAD over in Chamberlain. She's waving somewhere. Karen Cudmore with the South Dakota Department of Health, who's in Chamberlain right now. Stacy Fredenberg with American Cancer Society in South Dakota. Mary Johnson and Nancy Hostetter of the UNDCME office. So thank you so much to our planning committee. Oh, and we also want to thank our sponsors. So I want to thank the North Dakota Department of Health, American Cancer Society, Great Plains Tribal Chairman's Health Board, Community Healthcare Association of the Dakotas, Blue Cross Blue Shield of North Dakota, and the South Dakota Department of Health.
Shannon mentioned that UNDCME office was part of the planning committee. Those of you that are attending today that can use CMEs or continuing education units, physicians, nurses, and other allied healthcare professionals will be receiving 5.25 CMEs today for attending this training today. The bathrooms, if you haven't had need of them yet, are down the hall to the left of the door where Sarah's waving. Sarah, wave. We'd ask that everyone silence their phones, please. And if you do need to take a work-related call, if you would please just step out to do that. This is kind of going to be a marathon day. So if you need to stand, stretch, please feel free to do that. There's plenty of wall space if you just want to get up from your chair and stand along a wall and do some leg lifts and whatnot. Please feel free to go ahead and do that. So each of you should have a folder, and in that folder you were asked to complete a pre-test, and we will ask you to complete post-test. They're different colors. That's okay, because the reason that they're different colors is because we have breakout sessions this afternoon where half of you will be in one of the sessions and the other half in the other. So that's why the different colors. There's also an evaluation behind the pre and post test. We strongly encourage you to work on filling that out throughout the course of the day. If you are especially looking for CMEs, you have to fill that out, and you have to sign it and print legibly on the last page of the form, please. So those are important things. The CME office is very particular about those things, so just make sure that you complete it fully and then sign it, print it, date it, all that good stuff. The slides from all the presentations today are not in your folder. However, you'll have some options as far as accessing those after the training. You can receive them by email, or the other thing that we are going to also be doing is post all the slides on, we have an 80% by 2018 webpage on the North Dakota Department of Health website. And we will be giving you that webpage today later, or it's in one of the slides. Well, we'll make sure we get you that webpage address so that you can just go ahead and access the links and view it, save it, print it out if you so choose. Our day today, we'll be taking little breaks throughout the day. We are doing a working lunch with a panel presentation. So there'll be a buffet line for you to grab lunch, use the restroom, and plan to come back in here for lunch. And the two breakout sessions are this room and the room adjoining to this direction. This is west, I believe. So, well, just the adjoining room.
All right. And just a quick mention, there's some slides scrolling in the background here. Those are our CME disclosures. We had one minor change from what's on the evals to this, and that's just that our presenter will use some trade names of colorectal cancer screening tests today. So I'm pleased to also introduce now our first presenter, our keynote speaker, Dr. Gerardo Brooks, who is our Managing Director of Cancer Control Intervention with the American Cancer Society. So Dr. Brooks has worked for the American Cancer Society national headquarters since 2000. He's involved in the creation and implementation of strategies to improve the prevention and early detection of cancer and to reduce cancer disparities. He also serves as deputy editor of the Society's peer-reviewed journal, CA, a cancer journal for clinicians. He's a graduate of Ohio State University and the Wright State University School of Medicine. And Dr. Brooks completed his internal medicine residency and chief residency at Wright State's affiliated hospitals in Dayton, Ohio. He completed the Commonwealth Fund and Harvard University Fellowship in Minority Health Policy in 1999 and holds a master's degree from the Harvard School of Public Health. Before joining the American Cancer Society, Dr. Brooks practiced primary care medicine and served as medical director in community health centers in Ohio and in his current hometown of Dallas, Texas. In 2015, Dr. Brooks was honored with the Prevent Cancer Foundation's Laurel Award for National Leadership in Cancer Prevention and Early Detection. Please help me welcome Dr. Brooks.
Thank you, Shannon. Thank you. Hopefully my voice will hold out. If you haven't looked at the agenda, I'm on a lot today. First, thanks to all of you for coming out this morning. I was actually under the impression I was speaking to a group of local providers and teams, and learned this morning that some of you traveled in as much as 4 or 5 hours to be here. So no pressure. I'm feeling pressure to give you anything useful. I figure you're just here for vacation in beautiful Jamestown. All right, so we're going to be talking about colorectal cancer screening. As I say in airlines, if that's not what you're here for, if you didn't come for that talk, now's the time to go. We're going to start off with a presentation about the science behind the screening. And it's going to be fairly clinically oriented. And then the second session and later sessions today will focus more on how to translate this science into action in your clinics and your health centers. So, got a lot of information to cover, so let's get going. And where should I aim this thing to make it move? Where now? I know it was working 3 minutes ago, right? I got a lot of information to cover, and I haven't memorized it, so I really got to get these slides.